Hello, my name is Yarmila Ratz, but I go by Jackie. I was named after my mom. My mom took on Jackie as a nickname when we arrived in Winnipeg, Manitoba in 1968, when I was about 6 months old. So I became Jackie early on. When I was 23, I was diagnosed with stage 3 non-Hodgkin's lymphoma. I had a tumor in my chest putting pressure on my lung as well as on half my heart. It took over 9 months for me to be able to get my diagnosis, so the tumor had the opportunity to get quite large. It was about the size of a lemon and a small orange by the time it was discovered. Immediate radiation and chemotherapy followed. I was given a 40% chance of survival, but I made it. And then I had over 20 years of great living. I traveled, I was a fashion buyer, I got married, I traveled some more, I became a dog mom to 2 great dogs. And then at the age of 44, I had what is now described as a heart event. A diagnosis of chemo-induced cardiomyopathy followed very quickly. This came as a complete shock to me, as I did not recall ever being told that I could face heart issues 20 years later. Heart failure followed 3 years later, and along with the CRT-D implant, more pills and future heart transplant discussions linger. I have been living with heart failure since 2017. When I was first diagnosed with heart disease, I initially felt a sense of relief, as I thought it was initially cancer again. Then the realization that I now had a chronic illness hit. I went from 0 pills to 6 medications at the first cardio appointment. I felt shocked, alone, and very unprepared. Learning about my condition both helped and terrified me, as Dr. Google quickly found could be very unreliable and dangerous. Those initial years were very hard, as there was very little in the way of Canadian-based supports, either in person or online. Eventually, I founded my own support group online, and I wanted to find a sisterhood of understanding, sharing, and venting. And then, oh my goodness, has the last few years changed things? So much has improved for women and men who receive a diagnosis of heart disease and heart failure. The Canadian online communities for heart patients have grown. The Women at Heart program has gone virtual, and the growth of organizations such as the Canadian Women's Heart Health Alliance, as well as the Heart Life Foundation, has expanded. The patient support and access to conferences and summits has been excellent. It is an exciting time, as the more we know, the more we can be engaged in our own care and have better outcomes. I am stable and doing well because of the access to credible information, personal supports, and optimal therapy. Getting a diagnosis of heart disease or heart failure is really hard. In my case, a surprise over 20 years after surviving cancer. But it can be managed well if you are engaged in your care. Understand your condition, get help to handle the mental processes of the diagnosis, and if at all possible, join a support group online or in person. It will make a huge difference. It has in my world, and it's beyond words. I do not want anyone to walk in my shoes. Facing heart disease before the age of 50 was in some ways harder than facing cancer at 23. The reality is, for me, due to the intense chemo and radiation and proximity to my heart, the heart disease or failure was inevitable. But that is not always the case. Please encourage the men and women in your life to be able to get to know their heart early. Have a discussion with your doctor about your personal risks and what you can do about them. If I had, maybe I could have kept the diagnosis away for an extra 5, 10, maybe 15 years. Thank you so much. And please take your heart health seriously.
In support of WearRedCanada and the hashtag Her Heart Matters initiative, here with us today is Freya Kelly. Freya is the advanced practice nurse for the Cardiac Supportive and Palliative Care program at the University of Ottawa Heart Institute, where she participates in patient education, collaboration, and research. Her research interests include cardiovascular nursing research, research on cardio-oncology, women's heart health, patient self-management tools and resources, and evidence-based practice implementation. Today, we have the pleasure of briefly talking to her about female-specific information and challenges faced in dealing with cancer and its effects on cardiovascular disease. Thanks for being with us today.
My pleasure. I'm happy to be here.
Can you provide us with an overview of what cardio-oncology is and how it relates to women?
Sure. So with the advances in early detection and treatment, the number of cancer survivors has steadily increased since the 1970s. If we look at breast cancer in particular, the 5-year survival rate in the United States has increased from 75% in the 1970s to 91% in the 2010s. However, cancer survivors are at risk for long-term effects that may occur as a result of the cancer itself and/or its treatment, and can begin during therapy and persist beyond the end of the treatment. Future cardiovascular disease remains one of the most serious and life-threatening complications of cancer treatment. Specifically, cancer survivors living at least 5 years past their diagnosis are 1.3 to 3.6 times at more risk of cardiovascular specific mortality and have up to 18.5 times higher incidence of cardiovascular risk factors, including hypertension, diabetes, and dyslipidemia when compared to others of the same age with no previous cancer history. Moreover, as the Canadian population continues to age, this adds yet another layer of risk for future cardiovascular disease to this patient population. There has therefore been a call to address the increased risk of cardiovascular disease among cancer survivors. Again, if we focus on breast cancer in particular, the increase in cardiovascular disease is due to the cardiotoxic effects of breast cancer treatment, including, in particular, anthracycline chemotherapy and biology therapy, and due to overlapping risk factors for breast cancer and cardiovascular disease.
What are some of the known causes or risk factors associated with cancer and cardiovascular disease?
There's a great Venn diagram from Meta and colleagues published in 2018, which shows the risk factors for cardiovascular disease in one circle, breast cancer in another, but then highlights those risk factors that overlap both diseases. These risk factors include a patient's age, their diet, their family history, alcohol intake, hormonal replacement, obesity or being overweight, whether they participate in physical activity or not, and whether they smoke or not. Early research focused primarily on the consequences of treatments for breast cancers as a cause for cardiovascular outcomes. As a result, doses of anthracycline chemotherapy have decreased. Routine screening for a patient's ejection fraction became standard of care for those on trastuzumab, a biological therapy that can lead to reversible congestive heart failure. As well, oncologists became more mindful that tamoxifen, an adjuvant therapy for breast cancer, can increase the risk of venous thrombosis. Nonetheless, a recent assessment of the above risk factors, both modifiable and non-modifiable, has really taken the front seat. Given that increased cardiovascular risk appears to manifest itself approximately 5 to 7 years after the initial diagnosis of breast cancer, a potential window of opportunity exists for possible preventive intervention strategies, ideally offered through a cardiovascular rehabilitation program.
What information can you share with regard to steps that should be taken to face the specific challenges associated with cardio-oncology?
So in 2022, the European Society of Cardiology released their cardio-oncology guidelines with over 270 new recommendations. This is the first guidelines for cardio-oncology and is a huge advancement for the subspecialty. When describing the role of cardiac rehabilitation, it notes that high-intensity interval training, or HIIT, reduces cardiovascular risk factors and cardiovascular risk in patients with cancer in the active, and post-treatment settings. HIIT-related benefits on cardiovascular risk factors, physical activity behavior, fatigue, and quality of life that persist months post-intervention. In 2020, a study found that patients with early-stage breast cancer who experienced cardiovascular events after a cancer diagnosis had increased risk of recurrence and cancer-specific death. There is therefore now emerging evidence that having those cardiovascular risk factors, again, including diabetes, obesity, and high blood pressure, under control before starting cancer treatment will not only help reduce the risk of future heart disease, but also cancer-specific mortality. There's now therefore a focus on rehabilitation programs and how this can be standardized. Although, of course, most of the responsibility rests with oncologists, cardiologists, and primary care providers, patients need to be aware of their risk and continue to advocate for themselves as well. I want to highlight the Canadian Women's Heart Health Centre infographic, Cancer Enter Heart, under the What Can I Do section. First, know your risks. Work with your healthcare team to have your heart disease, diabetes, blood pressure, and cholesterol under control, especially before starting any cancer treatment. Some ways to do this is to eat a heart-healthy diet, aim to move 30 minutes a day, find support to quit smoking, and know your numbers, including your HbA1c values, your blood pressure, and your cholesterol values. Talk to your healthcare team about your need to visit a designated cardiac oncology clinic, which is becoming more common and available throughout Canada. Lastly, know as well that should you become diagnosed with cardiovascular disease in the future, that your cancer and/or its treatment could be a cause for it, and is therefore important to bring this up at your initial consult with your cardiologist.
And finally, could you share some words of wisdom or advice to the audience in support of raising awareness around women's heart health and well-being?
I think it is so important to share knowledge and self-management tips with my patients so that not only can they learn and be able to take an active role in their healthcare journey, but they can hopefully share this knowledge to their friends and family. With regards to the subspecialty of cardio-oncology in particular, I genuinely feel for these women who not only get dealt a bad hand with their cancer diagnosis, they then have the additional bad luck of cardiac disease on top of that, which can not only affect what type of cancer treatment they may receive or whether they can complete it or not. It can come back years later in the form of heart failure. So I think it is so important that we as practitioners not only share what we know about their future risk for cardiac disease, but that there are things they can do, such as exercise, eat a heart-healthy diet, seek help to quit smoking, and have their other comorbidities under control. These small things do add up and can really make a difference in the long term.
Thank you, Freya, for the valuable information that you shared with us today. We want you to be mindful, curious, and proactive in the management of your heart health and wellness, because to take care of others, you need to first take care of yourself. Stay safe and heart healthy. To learn about the unique aspects of heart disease in women and what you can do, visit WearRedCanada.ca or speak with your healthcare provider. And join us on February 13th for Wear Red Canada.